This is the respiratory system, starting on page 253 with anatomy. Air enters the nose and travels to the pharynx, which is the throat. From the pharynx, air passes through the epiglottis and the larynx, which is the voice box, into the trachea, windpipe. The trachea splits into two tubes: the bronchial tubes that carry air into the lungs. The bronchial tubes divide into smaller tubes called bronchioles that end in small alveoli or air sacs. The thin walls of these sacs allow oxygen to pass through them into tiny capillaries containing red blood cells. Red blood cells transport the oxygen to all parts of the body. In a similar manner, gaseous waste, carbon dioxide, leaves the blood by entering the alveoli and traveling out of the body through bronchioles, bronchial tubes, trachea, larynx, pharynx, and the nose. Our terminology on page 254, we have adenoido. This means adenoid. Adenoidectomy is the removal of the adenoids. Alveolo means alveoli or air sacs. Alveolar is pertaining to air sacs within the lungs. Broncho means bronchial tube. Bronchoscopy, the visual examination of bronchial tubes by passing an endoscope through the trachea windpipe into the bronchi. Bronchitis, inflammation of the bronchial tubes. Bronchiolo is bronchial. Bronchiolitis, inflammation of the bronchioles. Cyano means blue. Cyanosis, bluish discoloration of the skin due to deficient oxygen in the bloodstream. Epiglotto means epiglottis. Epiglottitis is inflammation of the epiglottis, the flap of cartilage that covers the mouth of the trachea when swallowing occurs so that food cannot enter the airway. Laryngo means larynx, so laryngeal is pertaining to the larynx, which is the voice box. Naso means nose, so nasal is pertaining to the nose. Rhino also means nose. Rhinorrhea, discharge from the nose. Pharyngo means pharynx. Pharyngitis is inflammation of the pharynx, also known as the throat. Phreno is the diaphragm, so phrenic is pertaining to the diaphragm. Pneumono means lung. Pneumonectomy, removal of a lung. Pulmono also means lung, so pulmonary is pertaining to the lungs. Tonsillo means tonsils, so tonsillitis, inflammation of the tonsils. And tracheo means trachea. Tracheitis, inflammation of the trachea, and tracheostomy, opening of the trachea to the outside of the body. Our pathology for the respiratory system: asphyxia. This is a deficiency of oxygen in the blood and increase in carbon dioxide in blood and tissues. Major sign is a complete absence of breathing, leading to loss of consciousness or death. Asthma, spasm and narrowing of bronchi, leading to bronchial airway obstruction. Atelectasis is a collapsed lung. Atelo means incomplete, and ectasis indicates dilation or expansion. Emphysema, hyperinflation of air sacs with destruction of alveolar walls. Along with chronic bronchitis, emphysema is a type of chronic obstructive pulmonary disease, or COPD. Hemoptysis is spitting up of blood. Hemothorax is blood from the respiratory tract in the pleural cavity, the space between the pleural membranes. Pneumoconiosis, abnormal condition of dust. Conio in the lungs. Pneumonia, abnormal condition of the lungs marked by inflammation and collection of infected material in air sacs, pus or products of the inflammatory reaction. Pulmonary embolism, clot or other material lodges in vessels of the lung. The clot or embolus travels from distant veins, usually the legs. And tuberculosis, infectious and inflammatory disease caused by bacteria, bacilli. The lungs and other organs are affected. Signs and symptoms are cough, weight loss, night sweats, hematitis, and pleuritic pain. Then we have our laboratory tests and diagnostic procedures. Bronchoscopy, a visual examination of the bronchial tubes with an endoscope. Chest X-ray film, X-ray image of the chest in an AP or anteroposterior, PA, posteroanterior, or lateral side view. Laryngoscopy, visual examination of the larynx via the placement of a flexible tube, laryngoscope, through the nose or mouth and into the larynx. Pulmonary angiography. X-ray images are taken of the blood vessels in the lung after injection of contrast into a blood vessel. This procedure has been largely replaced by computed tomography or CT of the lungs. Pulmonary function test or PFT. Measurement of the ventilation, breathing capability of the lungs. A spirometer measures the air taken into and breathed out of the lungs. Sputum test. Examination of mucus coughed up to detect infection. Tuberculin test. Agents are applied to the skin with punctures or injection, and the reaction is noted. Redness and swelling result in people sensitive to the test substance and indicate previous or current infection with tuberculosis. And ventilation perfusion scan, a nuclear medicine test that uses radioactive material, radiopharmaceutical, to examine airflow or ventilation and blood flow perfusion. Next, we have our treatment procedures. Endotracheal intubation. Tube is placed through the nose or mouth into the trachea to establish an airway during surgery and for placement on a respirator, a machine that moves air into and out of the lungs. Thoracentesis. Needle is inserted through the skin between the ribs and into the pleural space to drain a pleural effusion. Thoracotomy. Incision of the chest to remove a lung, pneumonectomy, or a portion of a lung, lobectomy. And tracheostomy, creation of an opening into the trachea through the neck and the insertion of a tube to create an airway. Our abbreviations: ABG, arterial blood gas. ARDS is acute respiratory distress syndrome. COT is carbon dioxide, a gas expelled from the lungs. COPD, chronic obstructive pulmonary disease, chronic bronchitis and emphysema. CPAP, continuous positive airway pressure, a machine used to keep airways open. CPR, cardiopulmonary resuscitation, technique to restore breathing and heart rate. CXR, chest X-ray, film or image. And O2 is oxygen, the gas entering the bloodstream through the lungs. MDI, metered dose inhaler. This delivers specific amount of medication to the lungs. A PE is a pulmonary embolism, a blockage of vessels in the lung by a blood clot. PEEP, positive end expiratory pressure, method of mechanical ventilation. PFT, pulmonary function test, measurement of the breathing capability of the lung. SOB is shortness of breath. URI, upper respiratory infection. VATS, video-assisted thoracic surgery, using small incisions and an endoscope. And VQ is ventilation perfusion scan, also called VQ scan.